and it's one of my favorite months. And Tim Wood, the plan advisor, says it's one of his. Good morning, Tim.
Good morning.
Great month. Tim Wood, and Tim, of course, the plan advisor, Medicare, Life, and Safe Money Retirement Made Easy. That's Tim Wood and the plan advisor. And Tim, this morning you said you wanted to talk about everything centered around one word, and that one word is changes. Go ahead and kick it off and explain.
Yep, it's things we have been discussing now for months with Medicare, all the changes that have come about. Today is the first day of the annual election period. So those of you that have been listening for months have heard us talk about, coming October 1st, we can actually have discussions about all the changes that will come for 2021. So that's kind of what I want to get into a little bit. I can't get into plan specifics over the radio just because of regulations.
Okay.
But I can give you some general ideas of some of the big changes that have come about. Once again, anyone that has a Medicare Advantage or a prescription drug plan, you're able to we can talk about the changes between now and October 14th, but from October 15th to December the 7th, is the time of year that you can actually make your change, and then that goes into effect January 1st of next year. Now, I recommend everyone look at their plan if you've got an agent, go ahead and get with them. If you don't, we certainly can help you. I recommend everyone do this every year, but this year there's some really big changes, and that's kind of what I just want to touch on real quick.
Okay, very
good. One of the first and biggest is for our veteran community. A lot of veterans out there that are retired, think that they're going to just stay with the VA, and they do, and the VA is great. The VA is fantastic. There's nothing wrong with the VA, but we now have a plan that has been designed specifically for veterans and is endorsed by the USAA. So coming in 21, there will be a USAA plan made specifically for veterans. Now, anyone can get it. I mean, you don't have to be a veteran to get it, but it makes sense for veterans to get it. And the reason it makes sense is because the plan is fantastic. Like I said, I can't get into plan specifics, but I would be happy to talk to anyone about it. But the plan is really strong, endorsed by the USAA. Now, this is a Medicare Advantage plan only. Mm-hmm. So you would still be getting all of your prescription drugs through the Veterans Healthcare System. This would just be essentially just for your doctors and your hospitals. Now, why would a veteran want to do this? The reason a veteran would want to do this is, number one, it gives you choices. That's the biggest reason, is it gives you choices. You don't always have to go to the VA. You can go anywhere. But number two, if you're ever traveling or you ever have to go into a regular ER and not a VA healthcare ER, there's a list of 10 things that has to happen for the VA to cover that ER visit. Mm-hmm. Well, if you have this insurance through the USAA, or there's other ones. I mean, it's not just that one. There's an honor plan through another company. But basically, if you've got one of these plans, it allows you to go to any ER or any doctor or hospital or anything, and essentially that's covered just like original Medicare would be. So it gives you a ton of options. So that's one of the big changes this year, is that there's a lot more options for veterans that are retired. And a lot of veterans also are thinking, well, the VA told us years ago that, we didn't need Medicare. And that may be the case, but if you look in your Veterans Handbook that they send you every year on page 14, now they recommend, and it's also on their website, and I've got a copy of it on mine if you want to look, they recommend everyone that's retired from the VA also have Medicare coverage, just for what I said. And also, right on their website, they say there's no guarantee of what's going to happen with VA coverage, so it never hurts to have a backup. So that's one of the big changes. Another big change is coming in the form of coverage nationwide for carriers. Mm-hmm. And what I mean by that is both United and United Healthcare and Humana. Obviously, they've both got very strong networks in our area, both of them. Mm-hmm. But now Basically, let's just, it doesn't matter which one. Whatever company either of those two that you're with, if you're in their PPO, it allows you basically to go to any provider that takes Medicare. But with their HMO now, here's the big change. With their HMOs now are nationwide HMOs. And what I mean by that is, let's just say you were on the Humana plan, to make it easy. You're on the Humana plan, and you need to go to the Cleveland Clinic for whatever you have. Well, there's a really good chance that that would be in Humana's network in that area. So basically, if wherever you needed to go, if that's in the network for that carrier in that area, wherever that area is in the country, then it's a simple phone call, a simple form, and essentially that then immediately becomes in your network. So it opens up. That was one of the big drawbacks to doing Medicare Advantage plans in the past, is that you basically had to stay right here. I mean, in the past, it even didn't go even as far as Knoxville. You literally had to stay right here, and that is not the case anymore. So that is a humongous change for Medicare Advantage, because it gives people the ability, if you need to go see a specialist, or, you get cancer and you want to go to the Cancer Institute or whatever, it now opens up, all over the country to these big companies. It opens up their networks all over the country, so you can go wherever you need to go to get the best care that you possibly can get. And there's a lot of other changes that are fantastic as far as the benefits that the individual plans have, the deductibles, the what they're doing in the plans, all the different things they offer. But I can't get into all those specifics on the radio. Like I said, I certainly can if anyone wants to give us a call or check our website. But there's a lot of really great things, but those are the two really big things that I wanted to point out. Number one is for veterans. There's a USAA plan that is going to start January 1st in our market, and that our HMO networks that are local with a couple of the big companies now are essentially nationwide HMO networks, and you can go anywhere that's in network for those companies.
Very good. Now, I know you said, Tim, you couldn't get into exact specifics, and maybe you can answer this, maybe not. On the USAA plan, with the changes, restrictions, is there any of that really to talk about? Service connection or active duty versus other, anything like that you can point out, or is that something folks need to get in touch with you about?
Well, no, there's no restrictions, but it's a Medicare plan. So, you would have to be Medicare eligible.
Okay.
So, you've got to be 65 or older, or have some of the other, conditions that could qualify you for Medicare. So that's really the only other big qualifier, is you've got to be Medicare eligible. You've already got to have your A and B. So that's a kind of a side note to this. But anyone that is a veteran, like I said, a lot of veterans were told years ago, you don't need to worry about Medicare, just stay with the VA. And you still can. You can still do that. That's fine. But the VA does now recommend, and like I said, it's on page 14 of your veterans book that they send you every year, or you can look on their website, or you can look on ours. They now do suggest that every veteran get Medicare once they're eligible. So now once you've got your Medicare, once you're eligible for Medicare and you've got it, this opens up a ton of benefits and, very recognized name, very reputable name. And it's a great plan. Like I said, I can't get into the specifics of the plan, but it is fantastic, and it's something that I think is going to really help a lot of veterans all around the country.
Carl, let me bring you in here if you want to there, and you might have a comment or two about what Tim is talking about there with the changes. Carl?
Yeah, Tim, we may not have enough time for you to really get into this. Just curious, though. I have Medicare Advantage, but I've heard a lot about, I don't know what else to call them, but Medigap plans. In other words, they would cover everything that Medicare would not. What's the difference between those two?
Okay, yeah, that's a great question. I'll try to do it as quickly as possible, and if anyone's got more questions, like I said, they can call or email or get on our website. Basically, the difference is this. A Medicare supplement plan essentially fills in the gaps in original Medicare, which is why it's called a Medigap plan. So you've got your original Medicare Parts A and Parts B, which is A is your hospital and B is your doctor. Not being general, but that's basically what it is. There's all kinds of gaps in it. There's deductibles, there's co-insurance, there's no maximum out-of-pockets, there's all kinds of, not negatives, but I mean, this thing was set up 40, 50 years ago, so when it was set up, it was great, but the original Medicare's got all kinds of holes and gaps and no maximums. So that's what this Medigap plan does. Essentially, it literally plugs in right over Medicare. When you have a claim, the claim goes to original Medicare, and then what they don't pay, then that goes to your Medicare supplement, and they pay the remainder depending on what the policy is and, all that kind of stuff. So that's a Medicare supplement. A Medicare Advantage plan, essentially, the easiest way to explain it over the radio is that it replaces original Medicare. Now, you've still got to have your original Medicare Parts A and B, but essentially what a Medicare Advantage plan is it's a plan from a private insurance company, whether that's Blue Cross or United or Humana or WellCare or whoever. It's a policy from a commercial insurance company that essentially replaces original Medicare. So that's the real difference. But the thing is, the Medicare Advantage plans have to cover, by law, have to cover everything in original Medicare. So you will never get less than original Medicare within a Medicare Advantage plan. But Medicare Advantage plans have so much more. They've got maximum out-of-pockets. They've got, in a lot of cases, no additional premium. They include vision. They include hearing. They include gym memberships. Some of them have what they call an OTC card, where they actually give you like a debit card, and they give you a certain amount per month or per quarter that you can spend on healthy foods and things like that. They've got so many different benefits that are all tied into it. A lot of them are, I mean, they're and especially, once again, I can't get into the exact plan specifics, but there's some changes just on the regular Medicare Advantage side coming for this coming year that are unbelievable. Some of these companies really stepped up in this area, really increased their coverage. I can give you one example. WellCare is a company in our area, and they, up until this year, they haven't included anything in the ballot healthcare system. So WellCare has been, I don't want to say they've been inferior, because they're not at all. They're a fantastic, great company. But in our area, it just hasn't been really feasible for a lot of people because nobody in ballot has been in there. Well, starting in 21, ballot now is a part of WellCare, so immediately all the WellCare plans now are right up there with the Humanas and the Blue Crosses and the United Healthcare. So that, and there's changes to all of those things too. I mean, Blue Cross has done some great things. Humana has really done some great things with their plans. They've really stepped up to the plate. United still got some really strong plans with their AARP plans. So there's some really big changes in the Medicare Advantage, but that's the big difference. The Medicare supplement basically fills in the gaps in original Medicare. Medicare Advantage is a private insurance company essentially taking the place of original Medicare, but they've got to cover what original Medicare covered, plus they've got a ton of ancillary benefit.
All right, it's a very important time, and for more information on changes, you can get in touch with the plan advisor, Tim Wood. The planadvisor.com is the web address, and then, of course, the phone number 262-7919. The Plan Advisor, Medicare, Life, and Safe Money Retirement made easy. Tim, we appreciate it. We'll talk to you next week.
I look forward to it. Take care.